will deal with what are the risk factors of acute coronary syndromes. So we divide these risk factors into modifiable and non-modifiable. Modifiable means these are the risk factors we can change after giving treatment. Okay, so if there is high blood pressure, that is hypertension, dyslipidemia, that is increase in total cholesterol, increase in LDL, increase in triglyceride level, or decrease in HDL. Okay, HDL, what will happen to HDL? It will decrease. Rest cholesterol will increase. So this, if this lipids abnormality is there, we say it is as a risk factor of your coronary artery disease. The patient is smoker, obesity, physically inactive, potato couch agar rahega patient, so then the patient is having at risk of developing acute coronary syndrome. Diabetes, stress, psychological stress, type A personality. So these are all your modifiable risk factors for development of atherosclerotic diseases. The risk factors which are non-modifiable, that means we cannot modify them. They are gender. Male gender is at risk of developing coronary artery disease, more common. Till the females are menopause. After menopause, they are at the same risk of developing coronary artery disease. Hereditary, if the patient is having sudden cardiac death, family history, young coronary artery disease, like age of less than 50 years of age, family member develops coronary artery disease, then chances of developing again acute coronary syndrome among them is very high. Age, as age increases, your symptoms of risk of coronary artery disease increases. So if you want to know what are the major big three risk factors of acute coronary syndrome, they are hypertension, dyslipidemia, cigarette smoking. All three increases the risk factor 8 times than the non-hypertensive, non-dyslipidemic or non-smoker person. Okay, and we should also add the lack of exercise as one of the new member. So if the person is having all these three risk factors and the patient is having diabetes alone, so they are both at risk of similar. So if the patient is having hypertension, dyslipidemia, smoking and physical inactivity, this is in the one side, and the other patient is developed only diabetes. Okay, so both are equally at the same risk of developing, even in the absence of hypertension, dyslipidemia, smoking and lack of exercise. Okay, so diabetes is also known as coronary artery disease equivalent.